Welcome, everyone. I want to thank you all for joining us for our second North Dakota Child Abuse Prevention Network call. I see a lot of familiar faces from last month and some new faces as well, and we are very excited for you all to join us. So thank you very much. As the organizers of the North Dakota Child Sexual Abuse Prevention Network, we would like to introduce ourselves for anyone that may be joining us for the first time or reintroducing ourselves for those who joined us last month. I will start. I am Kara Hickel. I work for North Dakota Health and Human Services in the domestic violence and sexual. Okay. If everybody's muted, it should be okay. So I work in North Dakota. Still getting a little bit of echo. Is everybody else hearing the echo, or is it just me hearing it? Okay. Well, I'll just keep going. So I work for North Dakota Health and Human Services and Domestic Violence and Sexual Assault Program as the Child Sexual Abuse Prevention Program Coordinator. And I am joined with my fellow organizers, and I will throw it off to Greg to introduce himself.
Hi, everyone. Welcome back to those who were here last meeting, and welcome also to the new people. Greg Kosowski. I'm the Executive Director of the Children's Advocacy Centers of North Dakota. Lindsay.
Hi, everybody. Can you hear me okay? My internet is being a little bit difficult. So I'm Lindsay Burkhardt, and I'm the Director of Prevention Initiatives, and I work with Families Flourish ND. We're so excited to see you all today.
So this is a bit of a refresher for how we got to this point with this Child Sexual Abuse Prevention Network. It started way back in 2017 as the North Dakota Child Sexual Abuse Prevention Task Force. It was through the legislature that they created this task force, and it started with 4 strategic goals, which were very broad. I won't go into them, but through the years, it started to become much more focused on child sexual abuse primary prevention, and that fell under these 6 pillars, which is where the task force focused a lot of its efforts in the last few years of its existence. Advocacy and policy was a big one. Awareness and education, collaborative practices, which is this network that we're at today is part of that, where we realize the importance of collaborative practices to prevent child sexual abuse. Funding and capacity, organizational policies and practices, and research is another of the 6 pillars that the task force operated under. The task force sunsetted last year, and the task force morphed into, so Lindsay Burkhardt was the task force director for many years, and then it morphed into a department at the state, which Kara Hickel is the coordinator of that child sexual abuse prevention area of Department of Health and Human Services. So the task force sunsetted, but we're still keeping the momentum on the work going, which is why we're here today. And one of the things, the task force did a lot of things, and we won't go into them, but Lindsay is going to highlight one of those, and that starts with, go ahead, Lindsay, one of the big things that you guys accomplished.
The resource guide. I'm excited to share more about that. Am I freezing or am I okay?
You're okay.
I'm a little okay. Greg and Karen know to pivot if I start freezing or something. I apologize, everybody. So I am going to share with you a little bit more about the resource guide. In 2002. So this information was, we wanted to learn more about what was happening across the state of North Dakota. And it was initiated then by the task force under the primary prevention subcommittee. There's actually some primary prevention subcommittee folks on the call today. So it's so fun to see so many of those faces. The goal of that environmental scan was to understand the current landscape of child sexual abuse prevention efforts across North Dakota. What's happening, what's working, and where gaps exist. In order to do this, the task force conducted an environmental scan in 2022. And that was really just a structured way of getting input from child serving organizations, schools, youth serving organizations across the state. So we did a 13-question survey by SurveyMonkey, and the questions really focused on prevention practices, perspectives, and experiences related to child sexual abuse prevention. This survey went out to, as you can see on the left hand, who responded. We had 203 respondents. We reached all North Dakota nation regions, 4 tribal nations, public, private, tribal schools, preschool and child care centers, and youth serving organizations. In total, 203 responses, which we thought was really, really, really awesome because the survey was only open, I think it was less than 3 weeks. So we were really excited for the amount of feedback we got, and we learned a lot. And one of the things that we feel really was important on the right-hand side of the screen, that education and training matters. What we learned is respondents who took the survey felt like child sexual abuse prevention, education, and training was very important, not only for children, as you can see at the top, but also for staff and also for parents and caregivers, feeling that that education around child sexual abuse prevention was very important. In the survey then, we were also able to identify gaps. And as you'll see, respondents thought that education was so important, right? But as you'll notice, not that many were actually implementing that education or that training. What we learned as well is, like, when we were comparing the community size and the responses, it seemed to evaluators who are looking at the data that the larger the community was, the more likely it was that child sexual abuse education was provided to various groups. There was also a sense that the larger communities placed greater importance on providing that education to younger children. We also asked respondents in the survey what they felt like was the greatest barrier. You know, if you feel important to provide this education, why aren't you, or what's the barrier? And what we learned is that 60% of respondents identified that they felt that the lack of established curriculum was the greatest barrier. Respondents also stated that another barrier was the social implications of providing the training or the education due to the topics or the topic of child sexual abuse as being uncomfortable or sensitive in nature. During the survey, we also asked about hiring practices, like when they're hiring a new employee or when they're onboarding volunteers. And we also wanted to learn more about the use of, like, codes of conduct, day-to-day safety policies, such as like appropriate boundaries, supervision, expectations for staff behavior. And overall, we learned that there was a lot of variation from entity to entity. Some reported having stronger child safety policies and practices in place, while others were more limited in areas. Maybe they didn't have a formal code of conduct, or they didn't conduct in-person interviews. They didn't check references for those new hires or volunteers, or they didn't complete the child abuse and neglect checks. So in response to all of the findings, the committee decided that we needed to develop the North Dakota Child Sexual Abuse Prevention Resource Guide, and you'll see that on screen. The guide was first created in 2023, and every single year since then, it's been updated. Because about 60% of respondents identified a lack of established curriculum as a barrier, one of the first priorities for this committee was to clearly share what training is available for adults and what curricula is available for children in an easy and accessible way. So the guide has lots of different options that are available, and we use QR codes so people can quickly look at them, check the price, see what ages they're meant for, what the curricula or what the training covers. The guide also includes policy guidance and best practice recommendations, addressing everything from, like, closed door policies and active supervision to considerations when working with both younger children and older children. In addition, it provides hiring and screening recommendations, including suggested practices and even questions to ask references during those reference checks. If you're interested in the guide, if you're like, oh, this sounds like it might be helpful, we just updated it and it's being printed for the 2026 year. We have a virtual copy available and we'll be sharing how to access that towards the end of our session today. You know, when we talk about preventing child sexual abuse and strengthening child safety in child serving organizations, that's a mouthful, there isn't a single strategy that really stands on its own. You know, education for children is important, training for adults is important, and strong, clearly defined child safety policies. Those all play a vital role, and they work best when they're in place together. You know, when one of those elements is missing or maybe unevenly implemented, it can create gaps, and usually unintentional gaps. But that's why the resource guide was built how it was, or how it is, to intentionally focus on all three of those areas rather than prioritizing one at the expense of another. It's exciting. We're also conducting another environmental scan. The last one we did was in 2022, and we're eager to learn where we're at today or this year. So the end of summer, early fall, we'll be kicking off another scan, and we'll move accordingly and we'll adjust our guide accordingly. So I'm excited for the next part of our session or our network meeting today. Before I move on to that slide, I just want to give a little gentle note before I proceed. We're going to be sharing a video, and this video is hopeful in nature and it's focused on prevention. But we also recognize that this work can bring up a lot of feelings, and I just want you to know that you're welcome to mute, turn down your volume, or step away if you need to.
So we had sent, or Lindsay had sent an email out to everyone who's part of the network, asking one single question: what motivates you to be involved in child sexual abuse prevention? We got a lot of responses and we put them all together here. And our goal here is an encouraging video that leaves you hopeful and motivated to keep doing this work. So go ahead and roll it, Lindsay. Hopeful. If your computer is lagging, maybe I could try and share it too, but let's see if you can. There we go. It does have music in the background and audio, which I do not hear. Maybe unmute Lindsay and try and share it or start it over.
Lindsay, just so you know, usually it helps if you just stop sharing and then you share again, and there's an option where you click like share video and audio.
Mm-hmm. Yeah, sorry, I'm really, of all days to have tech issues. I'm sorry, everybody. Let's try one more time. My internet was working just fine before this meeting. Try again. Here we go. Include sound. Everybody. Let's roll. Let me know, Greg.
What motivates me to be involved in child sexual abuse prevention is seeing the effects that child sexual abuse has on the child and the trauma that they endure is just very heartbreaking, and I want to be able to help protect those who can't protect themselves.
What motivates me to be involved is the fact that if we can prevent child sexual abuse, we know that we will reduce suicide risk.
What motivates me to be a part of child sexual abuse prevention is just the belief that protecting children is a shared responsibility.
What motivates me is prevention, the ability to use advocacy and education to stop the cycle before it even starts. because every child deserves to grow up without fear.
I am involved with child sexual abuse prevention because I believe in equipping children with age-appropriate tools to support their safety. It's really essential that we prevent all forms of child maltreatment so that we can ensure children can thrive and live happy and healthy lives.
It's important for me to work in child sexual abuse prevention because 12-year-old me finally has a voice, and I don't want any child to experience the things that I did.
I'm motivated to be involved in child sexual abuse prevention, not only to honor survivors and to stand beside the survivors in my life who I love, and to protect our children. I choose hope because prevention is possible for all children, for my girl, and for little me.
What motivates me to be a part of child sexual abuse prevention are the kids and families that walk through the doors of our center every day carrying experiences that no child should ever have to carry.
What motivates me to be involved in child sexual abuse prevention is to help promote healthy development, safe environment, protecting children's safety and well.
When it comes to the innocence of a child, nothing is more heinous than the violation of that child, especially in the sexual nature. That's why I've spent the majority of my career investigating these perpetrators and bringing them to justice.
What motivates me to be involved in child sexual abuse prevention is that every child deserves to grow up safe. Prevention is powerful. It means stopping harm before it ever starts. We can change the trajectory of a child's life.
What motivates me is the thought that my work could be part of answered prayers from a child who is trapped in abuse.
The more that we expose kids to this preventative education, the more likely they are to know how to identify those things to keep them safe.
I don't think the world's ever going to get to a better place unless we can assure that every youth is growing up in an environment that is safe, loving, and nurturing for them.
I'm motivated by a vision of North Dakota where child sexual abuse doesn't even exist, and where kids can live innocent, happy, carefree lives, just like they should.
Child abuse prevention matters because silence protects the abusers and prevention protects the children.
What motivates me to be involved in child sexual abuse prevention is the belief that every child deserves a safe and protected childhood. I'm motivated by the belief that prevention is possible and a responsibility to be a part of the solution.
We have the power to eliminate child sexual abuse completely. Through education, prevention strategies, we can empower not only the adults but our communities.
For me, child sexual abuse prevention is about protecting childhood and giving kids the chance to simply be kids.
What if we could prevent harm before it ever reaches a child? That is what motivates me. Prevention works, and every child deserves the right to thrive. How motivating is that?
Yeah, thanks everyone for submitting your videos. There is a link in the chat. I think that's Lisa maybe that put that in there. So thank you for sharing that. We'll share this on social media too. So feel free for your agency to share it as well. But I hope everyone is encouraged. There's just a lot of this is heavy work working in child sexual abuse prevention. Sleepless nights for many of you, I know, anxiety, stress. So we just bringing us together here. It's a time to have strength in numbers. And prevention is kind of a weird thing too, because it's hard to see the effects sometimes, like you're preventing something from ever happening. So you're not going to see it not happening. So just know that every action that we take, this meeting, what we do afterwards, every little action is going to prevent child sexual abuse. So I hope that you're encouraged by this today. Lindsay, Kara, did you have any other thoughts?
No, you did it justice, and such a powerful video. And I want to really just echo what Greg said, and we really thank everybody that submitted their videos, because it really shows how we have one voice together carrying this, and prevention can happen. So thank you.
Thank you, Greg. It's just so exciting to be a part of the network. So I had to stop sharing again. So I'm going to share. I'm going to try again. And then next time, everyone's going to remove me from this job. we go. Maybe. Are we back up?
We are. Time for announcements.
Yeah. Project updates. Okay, we have a couple different updates to share. I'm excited to share the first update. The 2026 CAP Month virtual series is back. Families Flourish ND has done them the last couple of years. This is our third year hosting it. We're excited every Thursday in April, happening at noon, from noon to 1. We will be having various virtual sessions. Topics include parents supporting their children in healing after trauma, from survivor to advocate, championing online safety for children in a digital age, fostering healthy bodies, and oh my gosh, fostering healthy boundaries and body awareness, meltdowns, mood swings, and regulation, helping kids handle big feelings. And then the last session of the month is from Common Sense Media. So we're so excited about that. It's Safe Screens, Healthy Kids, a learner's guide to digital content and child development. So I will share the virtual series flyer with network members in our follow-up email. And now I'm going to turn it over to you, Christy.
Had to find my unmute button. So as many of you know, I presented in February, I think it was, about CAP Month opportunities. This year, we have 9 grants that are going out across the state. It is going everywhere from Grand Forks to Beach down to Hettinger, and then from Williston, Crosby, all the way over to Valley City. So we've got a lot of different areas covered. We have 4 different programs outside of the CAP Month grantees. We're partnering with Turtle Mountain and Standing Rock as tribal nations who are also going to be hosting some events throughout the month for Child Abuse Prevention Month. The big one is, please mark your calendars for April 10th, which is the National Wear Blue Day. So we would love for you and your teams, your coworkers, friends, family, whoever, to wear blue that day, take a picture and send it to Lindsay, and she will be able to help us get it up on to our Facebook and acknowledge all that is happening. We also have some proclamations. The governor will be doing his proclamation declaring April as Child Abuse Prevention Month. He'll also be doing one for National Home Visiting Week, which is also during the month of April. And then I am picking up a proclamation from the city of Bismarck next Tuesday for April and for Wear Blue Day. So this year we're also excited because we're partnering with the 19 zones across the state for any of them that wanted to order some pinwheels to be able to share across and promote child abuse prevention. So that's what we have going on top of all the other activities. So now it goes to Greg.
Yeah, thanks, Christy. The ND Hope Project, many of you are familiar with this one. This is a response to all the high-profile child sexual abuse and exploitation cases, human trafficking back in 2025. So this is a group of 7 nonprofits, victim serving agencies, and we've banded together to do some awareness and education, and now even some prevention. So there's been a series of webinars. We've done 5 webinars so far. The recordings of those are on the website that I just put in the chat. We have one more coming up in our series before we push pause during Child Abuse Prevention Month, because Families Flourish has the series of webinars coming up for that. But the 5th webinar we have coming up, or 6th one I should say, is Your Child's Best Friend Might Be an AI Chatbot. And I'll put the registration link as well in the chat here. This is AI companion chatbots. If you're familiar with these things, kids, it's becoming a bit of a safety issue for kids. They're forming this strong emotional bond with an AI companion chatbot. They're asking for advice, sharing secrets, finding comfort in them and therapy instead of going to professional mental health therapist. And a lot of these conversations that kids are having with AI companion chatbots are going to dark places. A lot of sexualizing of conversations because these AI chatbots were built for erotic conversations. And so even though they roll them out for kids, they're still going in this direction because that's what they were built for. So sexualizing conversations, encouraging self-harm, and they're driving a wedge between kids and parents as well, where they're telling kids to do this, even though your parents are saying that's a horrible idea. So there's actually 2 webinars. Sorry, we got a lot of options coming up. So this one that I just put in the chat from the ND Hope Project is for parents and caregivers. A lot of folks on this call are professionals, and so I'm going to put one. This is a little more in depth. This is from Northern Plains Children's Advocacy Center up in Minot. This is a 2-part webinar series. The first part was yesterday, but the second part is going to come up March 30th. And this is for professionals. It's a little more in depth on what you need to know. And so this presenter, she's out of California. She's going to be presenting on AI companion chatbots as well. So 2 options there. One for parents was the first one, and then this one is for professionals. But feel free to attend both. I think that's very valuable information. The other item, Red River Children's Advocacy Center is also having their annual spring conference. I'm putting a link to that as well in the chat. This is 2 days in May. The early bird rate is $125. You can believe that 2 days full of training, only $125. The early bird ends March 27th. After that, it goes up to $150, but this is a really good conference. They've done it every year for a long time. So I highly recommend if you're in that area, or even if you're willing to travel there for a couple of days. It's a fantastic conference. And then I have one more because Dakota CAC, I haven't asked you if it's okay to share this one, but I assume your training that you have tomorrow is okay to share. I see nod from Jane. Thanks, Jane. So this is a multidisciplinary team training. There's a virtual option. This is another one as well. This is Cassidy Halseth and Annalena Lundy on evolving threats and online grooming, extortion, and AI-driven CSAM in North Dakota. So lots of topics around AI and CSAM, AI companion chatbots. So a lot of good options out there. I hope you guys take advantage of those.
And now it's time for our featured presentation. We're very excited, and it is our pleasure to introduce you all to Kirsten. Kirsten Balthazar earned both her Master's of Science in Curriculum and Instruction and in Curriculum and Instruction and a Bachelor of Science in Education from University of North Dakota. With a background in middle school and as a middle school and high school teacher, Kirsten is passionate about creating meaningful learning experiences for people of all ages. Having served as the prevention education supervisor since July of 2024, Kirsten is dedicated to prevention efforts with an instructional focus on healthy relationships and boundaries. She is also committed to advancing community education and strong community partnerships while promoting a culture of respect through collaborative efforts. And Kirsten, you can feel free to share your screen. Lindsay will stop sharing hers and take it away.
All right, awesome. Thanks so much. Let me just get this pulled up. All right, so hopefully you guys should see a screen that says red flag, green flag, March 9th or March 17th. That look good? Okay, but there's nothing else. There's no notes or anything that you're seeing, right? Okay, just I have a lot of different screens up, so I just always want to make sure that you're seeing what you're supposed to be seeing. So, hello everybody. Like they said, my name is Kirsten Baltazar, and I have the good fortune of working for the Rape and Abuse Crisis Center in Fargo-Moorhead. And with that, I am the Prevention Education Supervisor. So today we're going to walk through a couple of different things, give you guys just a little bit of a background of our team and where we're coming from. And then when you see RFGF, I just realized now too that I abbreviated. So RFGF is red flag, green flag, and that's a common abbreviation that we use. So we're going to go through and talk about the history of red flag, green flag, a little bit of an overview of what the curriculum actually looks like in a classroom, talk about some support and some evaluations that have been done on red flag, green flag, and then certainly want to give you guys some time to ask questions. But I'll also leave you with my contact information. And so if there's other things that come up after our conversation today, I'm more than happy to answer questions and get you the information that you are looking for. So like I said, I have the good fortune of working for RACC, the Rape and Abuse Crisis Center, and we are one of the domestic violence sexual assault agencies in North Dakota. Our mission is to essentially create a society free of personal abuse. So very much so in line with that idea of prevention is possible. We have a pretty comprehensive approach to our services, lots of different hats that our folks wear. We have our advocacy team, so there is a 24/7 crisis line. We do have counseling, and then we do have more of that community outreach. So I'm on the prevention education team, and then we also have the opportunity to do some work through community service coordination, such as the Elder Abuse Forensic Network, etc. We try to be as involved in our community as possible. And then we also have a Safe Exchange parenting time center. And then we do also offer offender services as well, classes for folks who have used violence. So with all that being said, RACC has been around for almost 50 years. And even though I know this is a North Dakota meeting, we also do some work on the Minnesota side of things. And so we're happy to, if you're have counterparts over there that are looking to get started with red flag, green flag, we are happy to work on the Minnesota side of things as well. So, like I said, I have the opportunity to work with the prevention education team, and I wanted to share just a few statistics because, like many of my counterparts that I talk with across the state, we are seeing a rapid increase in the amount of prevention education that our communities are desiring, which is wonderful. But then it also creates some, unique barriers for us in terms of how do we, as a team of 4 or 5 people, how do we get out and how do we offer all of the presentations that we're being asked to do? And so the numbers that you're seeing on the screen continue to grow and grow each year. And even though today we're just talking about red flag, green flag, we are, that's just one of 25 different programs that we do offer through our prevention education team. So to finally get to what we're actually here to talk about today, which is red flag, green flag. And essentially, to summarize, red flag, green flag is a child sexual abuse prevention curriculum that is intended for an early elementary age audience. At RACC, that means we're going into 2nd grade classrooms across the FM Metro and reading, essentially getting to read this picture book with kiddos. And in a couple slides, I'll go through a little bit more information about what the learning objectives are, etc. But I do feel like it's important to kind of understand the history of where this program started. And so back in 1980, RACC staff actually went to a children's theater production in the Minneapolis area, and they watched a presentation or like a children's theater production on this idea of good touch and bad touch. And they walked out of that with the idea that this could actually be turned into a children's book. And so came back and modified it a little bit with that idea of let's have red flags and green flags. And really after that, after the book was published, it took off and it was an overnight success. And so in the mid 1980s, we saw sales were skyrocketing. We had an entire team that was dedicated just to the packing of orders and taking orders and shipping them out. And so it was featured on Good Morning America. Oprah actually called. Apparently there was some scheduling conflict, so we weren't actually able to chat with Oprah about it. But it was a pretty novel concept because up to this point, nobody had really approached the idea of sexual abuse prevention, at least child sexual abuse prevention, through the lens of a children's book. It wasn't a thing. However, time did pass, research continued, and by the late 1990s, researchers, and rightly so, identified some minor issues with the curriculum. Things kind of like there was a little bit too much of stranger danger emphasis placed on in the original curriculum, and also some concerns about maybe putting a little bit too much responsibility on the child when really we know that adults are the ones that are responsible. And so throughout the early 2000s, the RACC prevention education team made some modifications to try to catch up to the research, but it wasn't until 2017 that the book went through a major revision. And with that, there was a pretty extensive literature review that took place. And I'll reference a couple of those studies that were used in the literature review. But essentially what was able to happen after this curriculum was revised, brand new illustrations definitely brought it up to the modern times, really incorporating some of those technology aspects. Now, AI wasn't a thing in 2017, so that'll probably be the next revision, but just this idea of like internet safety, bringing that into the picture with child sexual abuse prevention. And unfortunately, what we saw when we brought it back into the schools is a large increase in the number of children disclosing during and after the presentations. And while that's very disheartening to hear, we were very encouraged in the sense that this curriculum was able to speak the language of second graders and to then connect them to the resources that they would need. And so today we continue to use that version of red flag, green flag. Just this past school year, we were able to see almost 3,000 students throughout our North Dakota and Minnesota counties that we serve, and that equated to about 282 presentations. That being said, I don't have a true statistic on how many times red flag, green flag is taught around the country or around the world. That would be so cool to be able to somehow track that. But as I had indicated earlier, red flag, green flag was very popular in the 1980s, but we are still selling it to this day. It's not nearly the amount of sales that we had in the past, but it has been sold, and I tell myself that it's still being used in all 50 states and 141 different countries throughout the world. So that gives me a lot of hope that kids throughout the world are receiving these messages of prevention. So when we break down red flag, green flag, you're probably thinking, great, I've heard all about the history, I've heard kind of what you guys do, but like, what is red, like, what does this book actually do? And so essentially what it is based off of is the 9 principles of prevention. And through that, we really try to hone in on each of those areas of prevention. For the sake of time, I'm not going to go through every single one of them today, but I'll hit on a couple. First of all, and this mostly comes from my my teaching background, that although it's not necessarily stated explicitly as we need learning objectives as a principle of prevention, it's just good teaching practices, right? And so learning objectives, what we identified through the literature reviews, there's 4 different areas. And really these learning objectives, they're kind of designed to do two things. Number one, we are enhancing the knowledge acquisition of students. And so by the time they're done with this 2-day program, they're going to have a better knowledge and understanding of what it means to have body ownership, what personal safety looks like to them, and then being able to identify the wide range of helpers that they have in their community. The other thing that we're focusing on in addition to that knowledge acquisition is actually a skill, like an action of being able to do something. And that comes from the assertive response. And we call it the chant, for lack of a better term, but there's some actions that go with it, but the students are able to practice this chant, which essentially is the response that we want them to have, is say no, get away, and tell a helper. And so that assertive response is reflected as one of those, one of the key learning objectives. We also, as I had indicated, are very much so wanted to root, as we were doing the revision, wanted to root it in theory and what the most recent research was showing us. And so, for example, and I know that you guys know this, right, as practitioners and professionals in the field, but there was this idea that we really needed to change the idea that these red flags, so to speak, would be coming from strangers, right? It started off in the 1980s. It was a lot of this stranger danger. And if you go back to curriculums or books from, 40, 50 years ago, it was heavily rooted in that. And so we were able to see that that was something that drastically needed to be changed in the revision. But how do we do that, right? How do we talk about some of these things could be coming from somebody that you know? And so that is something that was specifically addressed in the curriculum. Similarly, we also really wanted to focus on the promotion of protective factors, whether that's through the CDC, whether that's through whatever measures we're using. We really wanted to hone in on the idea of we're developing positive peer relationships, we're developing a connection with strong adult mentors, and we're laying the foundation that there's a community that has no tolerance for violence. And so throughout the book, there's little things that we were very strategic about doing to make sure that all of those protective factors were being layered in at this specific age level. And that's actually a question that we frequently get with the community of why second grade, why an 8-year-old, like this is too young to be talking about with such a little kid. And I get it, like I understand it. I don't have kids of my own, but I would also have questions if you were talking to my 8-year-old about child sexual abuse prevention. But when we look at what the research shows is that it actually is 7 to 8 years old. And there was a specific study done. I want to make sure I have the year correct. 2000, a 2000 report found specifically that younger children had more gains following prevention programming compared to older children, 9 years and above. And so that's why we really honed in on that early elementary age level as such an important formative time. And the way that the curriculum approaches this idea of red flags is so beautifully age appropriate, because we're talking about red flags are simply things that make us feel uncomfortable. So nowhere in the book are we describing child sexual abuse at a graphic, inappropriate level. We're saying it's things that make us feel uncomfortable. So maybe it's your friend says something really mean to you and you tell them to stop and they keep doing it. Maybe an adult is tickling you and you don't like tickles. And then we go on to tell them, if you feel uncomfortable about it in your tummy, that's probably a red flag. And then what do? We go say no, get away, and tell a helper. And so we also try to make sure that we're engaging the kids through a variety of teaching methods. They do have the opportunity of coloring and labeling situations as red flags or green flags. And we also want to make sure that we're involving families in those conversations. And so, like I had indicated to you guys, I do get some phone calls from parents about what kind of curriculum are you doing in our classroom? And those are conversations that I'm excited to have, because I look at it as an opportunity to really engage the family in that process, and something that we would love to continue building on as this program expands is having education classes for parents about what the curriculum is and how they can support our efforts at home as this curriculum goes into implementation in the schools. So coming from a teaching background, I always feel that it's important to connect to the current health standards or whatever specific subject area that we're working with. And so I'm not going to go through and read all of these, but a conversation that I frequently have with school districts, which understandably so, say, why should you come into our classroom? We have so much that we need to teach. Absolutely, I understand. I was in the classroom a couple of years ago. I absolutely get it. But not only is this topic area very important for a variety of social and developmental reasons, but we also see here that it meets several of the health education content standards as well. So another one of the areas through the 9 principles of prevention that we know is so important to any type of prevention programming is looking at our outcome evaluation and making sure that what we hoped would be theoretically sound in practice is it actually doing the job, right? And that gets a little bit tricky, especially when we're coming to evaluating child sexual abuse prevention curricula. And so certainly we're actually at exploring through CARA and then a few other partners at the state level what are new in the new era of red flag, green flag, what evaluation efforts can look like. But in the past, there have been some pretty eye-opening and noteworthy studies and research done that does favor red flag, green flag, and its implementation in the classroom. So even going back to that first version of red flag, green flag, there was a study that showed that there was a greater knowledge that students had of sexual abuse and prevention compared to a control group study that had used a different child sexual abuse prevention curriculum. And then in 2012, so again, this was before the major revision in 2017. Actually, I find this so interesting. The question, what is a red flag touch? Students, their knowledge of what a red flag touch was actually improved shortly after 1 year after and 2 years after. So the further they got along from the curriculum, they were actually able to retain that information, and more students that were surveyed were actually able to correctly identify the what is a red flag. And so researchers interpreted that result as there's both short-term and long-term retention for this programming. And then most recently in 2024, I know it's Minnesota, so take that with a grain of salt, but we love Minnesota as well. The Minnesota Children's Alliance actually did a review of a variety of child sexual abuse prevention curricula, and they didn't necessarily rank them in order, but they went through according to a variety of different areas, such as the program structure, the program content, and how the program is delivered. And they went through and there was 3 different categories, and the red flag, green flag received the highest category of ranking, specifically looking at its adherence to the research base. We also had an opportunity to survey some teachers as we were preparing to do our revision in 2017. And so to me, some of these questions are very, very valuable when we look at not only the impact that it's having on kiddos, but the impact that it's having on adults. So I'll give you guys just a minute to kind of read through that on your own. And this was a total of 70 teachers that took the survey. I'm also going to show you guys a quote that came from some of the qualitative data that we collected. Red flag, green flag is one of the best programs I've had the opportunity to take part in because of my tenure as a teacher. You will never fully know of the impact of your program because of the sensitivity of the subject matter. I am proud that my community has red flag, green flag. So as we look towards the future of red flag, green flag, we're exploring a lot of different options. As many of you know, there's a new Senate bill that was put into effect about a year ago, Senate Bill 2330, that requires human trafficking education for 6th, 10th, and 12th grade students, and we're looking to see how this idea of red flags and green flags can help us aid in the conversation about warning signs that we need to be looking for human trafficking. And we're also looking at wanting to be able to make sure that this curriculum is accessible for for all different types of populations. So whether that's students with disabilities, whether that's Native Americans, whether that's looking at translating this into a variety of languages. I had shared earlier about having a class specific to parents and helping them understand what they can be doing at home as they're reading red flag, green flag in the book with the kiddos. And so all of those things are really exciting to us, and certainly it's been around, like I said, for 40 plus years, but we're absolutely excited to continue moving it into the this next era of red flag, green flag. And at the end of the day, as I kind of bring things to a close here, is I want to emphasize that our hope is that this curriculum can fill the gap that Lindsay was talking about that was identified in that environmental scan, where a lot of practitioners, teachers, school professionals, etc., they want to have these conversations with kiddos, but they're not quite sure how. And our hope is that red flag, green flag can at least be a start, can be a guide to how these conversations can take place. There is a facilitator guide that is also available to go along with when somebody purchases the curriculum, and that it gives learning objectives, it gives instructional speech, it really walks you through the process of how to get started with red flag, green flag. And that, like I said, is we're working on expanding programming. We are also working on developing there's going to actually be a specific individual on our team that is going to be devoted to helping other agencies get started with red flag, green flag if they're wanting to implement it in their school district or in their area. And so we truly believe that this is something that should not just be staying in the Fargo-Moorhead area. We believe it's truly effective and should be shared it with as many folks as possible. So with that, I'm going to turn it back over to you guys and see if there are any questions that you have. I do also have some contact information if you're wanting to learn more about red flag, green flag. We're also happy to send a complimentary copy to you or your organization if it's something that you just want to check out and learn a little bit more of. Please feel free to reach out and we can look at that as well. So any questions?
I had a question, Kirsten.
Yeah.
You talk a little bit about the age groups. I think you said second grade, right? Does it work for younger kids, older kids too, or what sort of range would you say?
Yeah, so technically we kind of shoot for 7, 8, 9-year-olds. That's what we found is the most effective. And when the curriculum was developed, that was the reading level that it was matched to as well. But I will also say, as a caveat, I've seen it used in 5th grade classrooms with the caveat of saying, okay, 5th graders, I know this is kind of little kiddish, but the message is still really important, and that teacher is kind of able to modify it to meet the needs of the more developed learners. I'll also share though too that we make references to red flag, green flag when we're doing presentations in a high school. We'll go back and say, hey, these are some of the warning signs. These are some of the red flags that we talked about when you were in 2nd grade. So that's a complicated answer, but I truly think that there is a range. We are currently working on a curriculum for our preschoolers. Technically, there is one from way back in the day, like the 1980s, that went along with red flag, green flag. It was called the ABCs of safety. But unfortunately, as we saw with the older version of red flag, green flag, it's very much so rooted in that idea of stranger danger. And so we're looking to majorly revamp that one and make that available for preschool, kindergarten, first grade. All right. Well, I'm trying to give the appropriate amount of wait time. I'm going to turn it back over to Lindsay, Greg, whoever else is overseeing the meeting. But thank you guys so much for the opportunity to share this information, and I'll connect with Lindsay and I'll get this PowerPoint out, and that way people can have access to the contact information, or if they just want to reference any of the other pieces that were shared. So thank you so much for your time today.
Amazing. Thank you, Kirsten. We just have 2 more slides that I'm going to share here. All right, here we go. Then we're going to wrap up. All right, I hope everyone can see the next steps slide. Okay, good. I saw a thumbs up. I'm a little nervous now. So we put together a website where you can find recordings, you can find meeting minutes, resources shared. So we would just encourage you guys to go check it out. The link is posted there. There's more to come. Our next meeting for everyone's calendar is May 21st at 9 a.m. We'll be getting that invite out this week sometime. If you know others who would be great additions to our network, please share that survey with them that we shared at the last couple of meetings, or the last meeting with you. Next time, we're going to have a spotlight speaker of Dr. Elizabeth Jeglick, and she's going to come and share a lot of great research on grooming. So it's going to be a great session. We've had such great speakers so far, just amazing spotlight speakers. So thank you again, Kirsten, for coming today. And then lastly, Greg, Kara, and I value and welcome your input. So if there are things that you'd like to see on future agendas, please reach out to us with any suggestions. We're happy to have those. And this is our network for all of us. So we want your feedback. And then there's our contact information. But otherwise, it is 2:58 p.m. I don't know if there's anything else, Greg or Kara.
Oh, enjoy your St. Patty's Day, everyone.
Yeah,
Should
thank
have
you.
looked to see who was wearing green. Kim, way to wear green. Love it.
Thank you, everybody.
Thank you, everyone.
Thank you.